An appropriate patient for the clinic would be someone who is suffering from a painful condition. And we can manage pain that is more acute, more recent onset, can be helpful from that standpoint, but often the primary care physician is perfectly capable of managing those situations as well. But we certainly are able to help out when the primary care physician feels that they might need some support. So someone who has a herniated disc with radiating leg pain or an arthritic joint or whatnot, those types of situations we certainly can help. We also are set up to help patients with much more complex issues who have significant pain and suffering that's been happening for many years. And I think in that situation we are uniquely qualified because of the team that we have. Our clinic is really set up with a four-pronged approach. So first, we can manage the pharmacological issues that patients sometimes require for their painful condition. Second, we can help pain from the standpoint of cognitive behavioral therapy or psychological help when people have associated depression or anxiety, or if they're just having a hard time coping with their pain. Third, we can help rehabilitation-wise in trying to help restore function. And lastly, patients often need interventional strategies.
In our practice, we have many different tools for diagnosing and treating painful conditions. One of these tools is electrodiagnostic testing. Now, these tests are used to differentiate the different causes of numbness, weakness, and other conditions that can be confusing to clinicians. We've had many patients come in with conditions and symptoms that they weren't sure whether they were being caused by nerve issues up in the neck or down farther in the arm. The EMG and nerve conduction studies have helped us to identify the difference between a carpal tunnel syndrome, which can cause numbness in the thumb and index finger, versus a C6 nerve root impingement, which can also cause symptoms in the very same distribution. From the testing results that we get, we can avoid treating the neck unnecessarily if it's carpal tunnel syndrome, or likewise the wrist unnecessarily if it's a cervical nerve root problem. Identifying the proper source of a painful condition is important when you're designing a treatment program. If it's a muscle problem, the treatment is going to be different than if it's a nerve problem. Many people ask us, when is a good time to have a nerve conduction study or an EMG? And typically, if you have pain, numbness, weakness in the arms or legs, that's a good time to get an EMG and nerve conduction study.
I had a great experience. I was going through very difficult challenges as I was trying to cope with my pain, which stems from a chronic illness that I have, and affected me deeply, emotionally as well as physically. And so the help I received here was probably not an exaggeration to say it was life-changing.
It's very unusual to have chronic pain and have it not affect more than just your body. It can affect your work, it can affect your activity levels, it can affect your relationships, your mood, your anxiety levels, even your sense of identity. And as people are trying to adjust to the difficulty of a pain condition, it's often useful to have psychology on the team to help them with it. When you have a pain condition, you're at a unique risk for becoming addicted to your medication, because pain, what's going on physically and what's going on emotionally have this bidirectional relationship with each other. And if things aren't going well physically, it's often hard emotionally. And if things aren't going well emotionally, it's often hard physically. We work with people a lot on helping them to be able to manage their medications safely and to use them in a very healthy way that helps them live their life in a valued way and keeps their pain from getting in the way of their life more than it needs to, but also helps them not be too dependent on the medications to be able to do those things. Even though a lot of our patients work with our medical side of our treatment along with psychology, you don't have to. You can work with just psychology. For example, if you're a patient that's already getting your pain managed in the way you need to medically, but the facility you're working with doesn't have pain coping group or relaxation group or some of the things that we offer to help cope with your pain from a psychological standpoint, please come, you're welcome.
What makes our pain management center unique is the fact that you have the doctor, the physical therapist, everybody involved in your care in the same location. So if there's a problem, I can go right across the hallway and get it taken care of for a patient. And also, we're tuned in to the specific needs of patients with chronic pain, and they're different than people who have acute sprained ankle. Someone who's got chronic back pain is a whole different problem. When a patient first comes to see me for physical therapy, have them come in, they fill out a form, and then I sit down with them one-on-one and we talk about their problem. And not only about their problem, but what they want to accomplish. Because it's not, everybody wants to get rid of their pain, but they also want to be able to get back to playing tennis or being able to play with their grandchildren, be able to do the things that make their life meaningful and give purpose to them. So we want to focus on those things rather than just focusing on the pain. After we identified the specific problem, then we aim specific treatments at it. And the treatments we use are ones that are shown to be effective. Once we begin a program, I go through it with you one-on-one. I don't turn you over to a high school kid who's an intern at our program. I work with you, and I'm the one that will work with you until you feel better. Because it's a chronic problem. It's been going on for a long time. If the easy things would have worked, they would have worked already. And so you need someone that's got expertise in this area to work with you, to listen to you, and to change things so that we can be successful. Another unique thing here is that when we focus on the right treatments and we do the right thing at the right time, you don't have to have an extended course of physical therapy. So we can help you learn what you need to know in a matter of a few visits rather than 20, 30 visits and exhaust your benefits. We want to be good stewards and help you get better in the long run. And part of that is teaching you what you can do on your own to take care of it.
I would definitely recommend Utah Valley Pain Management and have to several friends already because I felt like for the first time in several years I was really making progress. I really appreciate the way that they combined the psychology and the physical therapy and the traditional medical, and I felt like working with all of those things together was what really brought me into a better place.